Fully vaccinated individuals in regions under Phase 1 of the National Recovery Plan will be allowed to dine in at restaurants starting tomorrow. Caretaker Prime Minister Tan Sri Muhyiddin Yassin said this was among several relaxations agreed at the National Security Council meeting today. For dine-in activities, Muhyiddin encouraged eatery operators to set up more tables outside for better ventilations. Families where both parents are fully vaccinated are allowed to take their children who are under 17 years old to dine in with them subject to strict SOPs. Weekly and night markets will also be allowed to operate. Other relaxations for the fully vaccinated include recreational and sporting activities that do not involve contact and teams. Perikatan Nasional has unanimously agreed to nominate Datuk Sri Ismail Sabri Yaakob as Prime Minister. But Chairman Tan Sri Muhyiddin Yassin said the support comes with a condition. He cannot appoint any ministers that are facing criminal charges.
In a statement today, he said the support for his coalition's 54 MPs came with the condition that cabinet members who will be appointed are those with integrity, trustworthy and free from any criminal charges in court. Earlier today, 114 MPs from PN, Barisan Nasional and Gabungan Parti Sarawak GPS as well as independents were granted an audience with the Agong to verify their support for Ismail Sabri to be the next PM. Muhyiddin said PN decided to back Ismail Sabri to ensure continuity in the government's policies.
UMNO Vice President Datuk Sri Ismail Sabri Yaakob appears to have garnered enough votes to be appointed as Prime Minister. Despite that, as of now, there is no official announcement yet on when the swearing-in of Malaysia's 9th Prime Minister. However, we would like to turn our attention to East Malaysia, or more specifically Gabungan Parti Sarawak, on their role in determining the leadership of the country. We have with us Ivy Juga from the Faculty of Administrative Sciences and Policy Studies, UiTM Sarawak. Thank you for joining us here tonight, Ivy. Now, Ivy, with the way support that was given to potential PM candidates, how pivotal was GPS in determining the next leader of Malaysia?
Okay, thanks, Farhana. In every general elections, Sarawak is well known as the election kingmaker in our country, right? And currently, as everyone knows that all the total numbers of 18 member of parliaments from GPS party, they are in one voice in choosing, to support on who is the prime minister, okay, for our coming prime minister, okay. And as for now, okay, they leave it to our YDPA to decide on who is our prime minister, but for sure, the total number of the total 18 member of parliaments from GPS, they are one voice in regards to this matter. Yeah, they become in every election they become Sarawak is a Sarawak Sarawak political party is become election kingmaker. Yeah.
Ivy, previously you can see how GPS was instrumental in helping Tan Sri Muhyiddin Yassin in securing his post with current political dynamic. What role will GPS play in the new cabinet?
In terms of role, this is the same like previous. The previous government, federal government. Their role is basically to fight on Sarawakian rights, Sarawakian matters, especially on the Malaysian Agreement 1963, right? And this is the time, for Sarawak, or specifically for GPS, to demand more, to demand a better position in federal level. Yeah, like for example, they might demand or pressure to have deputy prime minister from Sarawak, okay, and also in terms of to continue on fight for the Sarawakian rights, especially as stated in our federal constitutions, and also all the matters that they're still ongoing now. That they're working committees of the Malaysian Agreement 1963, especially in terms of to have more autonomy, okay, to given to Sabah and Sarawak. Right, so this is the time for GPS in the new cabinet to fight harder, okay, for the purpose of to ensure all the betterment of the to be specific to a Sarawak state government. Yeah.
All right, thank you, Ivy, for sharing your thoughts with us. That was Ivy Juga from UiTM Sarawak. The discussion is not over, with GPS playing a pivotal role in taking UMNO's Datuk Seri Ismail Sabri over the 111 line. Tonight on Consider This, we asked our guests how parties from East Malaysia were positioned in this crisis. In anticipation of the formation of the new government, how can we ensure that upcoming strategies will be able to bring Malaysia out of the pandemic? Dr. Carmelo Ferlito from the Centre for Market Education highlights the need for the country to go back to normalcy by adopting a fresh new strategy focusing on the lives and livelihoods of the people.
That after 18 months of the Perikatan National Government, somehow we didn't find the right balance between the management of the pandemic and the management of the other aspects of the life of the people. And I think that also the strategy has been stubbornly focused on lockdowns, waiting for miracles from the vaccination, without understanding and realizing the complexity that was involved, that is involved in the situation we are experiencing. We need desperately someone that understands, realizes how complex is the phenomenon and is able to come out with a new synthesis.
Dr. Carmelo outlines a few strategies in which the government can explore to improve the livelihoods of the people amid the pandemic.
First and foremost, I would put into the agenda the introduction of GST, and in particular a targeted GST to support direct investment in strengthening the healthcare system. So if we are going to live with the virus for still quite some time, we need to invest heavily in making our healthcare system adequate to handle the situation in case the infections would rise again. And I would also advise the government to put together an emergency table for households that are undergoing financial stress, people that have lost the job, and etc., to help individuals and families to find their way back to financial stability with the opportunities that are present in the system.
We'll take a short break. Stay with us. Welcome back. The majority of people infected with COVID-19 generally recover within 2 to 3 weeks, depending on the severity of their illness. But some continue to experience post-COVID-19 syndrome or long COVID, in which symptoms can last weeks or even months after the infection is gone. To understand better what causes long-term COVID complications and what symptoms to look out for, we speak to Dr. Erickson Chia Kwan Min from Sunway Medical Centre.
As we learn more and more about the COVID virus, it seems to us that it not only causes long-term complications to the respiratory system in the body, but it also affects the other organ systems in the body in the long run as well. Some studies have also shown that there have been psychological complications being reported. And with the large number of cases that we have in Malaysia and also worldwide, some of the public health experts have actually warned that long COVID could very well be the next public health disaster in the making.
Dr. Erickson outlines some of the common symptoms of long COVID that patients may experience.
In Malaysia itself, we do have some data that up to 60% of the patients do experience long COVID symptoms after 12 weeks from the initial diagnosis of COVID-19. So this is about 6 out of 10 patients who have had COVID who may present with long COVID complications. Some of the common symptoms that they do have fatigue, breathlessness on exertion, difficulty sleeping, cough, and also some chronic pain. These symptoms will definitely affect a patient's quality of life and their day-to-day activity. Imagine just becoming breathless, just going up a flight of stairs, being unable to think clearly due to brain fog, having persistent pain. These things can also lead to depression as well.
Sunway Medical Centre will be among the first COVID recovery clinic established in the country, hoping to treat patients who suffer from prolonged COVID symptoms.
So Sunway Medical Centre will be the first private facility to offer this, we call it the COVID Recovery Clinic, in which we have a structured, multidisciplinary and a holistic approach towards managing patients who do present with long COVID symptoms. With the establishment of a proper COVID Recovery Clinic, this would also help patients who not only are from Sunway Medical Centre, but from probably have been discharged from other hospitals who do have long COVID symptoms and are seeking a way to assist them to elevate their symptoms.
With the Taliban in control of Afghanistan, countries are racing to evacuate their citizens and Afghans who had worked for them. Flights are still taking off around the clock from Kabul's airport, but the Taliban is reportedly now blocking all Afghans, including those with necessary paperwork, from getting to the tarmac.
Taliban fighters control the roads and checkpoints around the airport and had fired shots to control the crowd. At least 12 people have died at Kabul airport since Sunday, including 3 anti-Taliban protesters yesterday. European Union's top diplomat Josep Borrell said that the bloc cannot rescue all Afghans from the country as thousands continue to scramble to get on flights. Meanwhile, the International Monetary Fund said it has blocked the release of $450 million in funds that were scheduled to be sent to Afghanistan next week.
New Zealand's COVID cluster has grown to 21 cases as 11 new infections were reported today, all in Auckland. Prime Minister Jacinda Ardern announced today that children between the ages of 12 to 15 would now also be eligible for the vaccine starting from September 1st. Ardern said the virus has been in the community for as long as authorities had linked its origin to a returnee from Sydney on August 7th. The first case, a 58-year-old man from Auckland, emerged on Tuesday, prompting the government to put the entire country into a lockdown. The latest outbreak has exposed New Zealand's low vaccination rates. Only about 23% of its 5 million people have been fully vaccinated, the lowest rate among the 38 OECD nations. Ardern had announced plans for a gradual reopening this month following pressure from businesses, but the new cases may delay those plans. That is all we have for you on AWANI tonight. Get the latest news update on COVID-19 and COVID-19 vaccines from astroawani.com and the Astro AWANI app. I'm Farhana Sheikh. We'll see you again.
Time, reality, it's changing.